We're going to take you, excuse me, we're going to take you back to a press conference that the Health and Human Services Secretary Robert F. Kennedy Jr. is having here in Washington, D.C. It is about the rising rates of autism among American children from a new CDC report that was released. He's talking about that now. Let's listen back in.
The epidemic is real. Between 1959 and 1965, researchers from 14 hospitals associated with major universities undertook the National Collaborative Perinatal Project, tracking 30,000 children from birth to age 8. This was no half-baked survey-based analysis. The study conducted 9 separate screenings covering neurology, psychology, speech, language, hearing, and visual function. Every developmental quirk, anomaly, and disorder was logged with painstaking detail. Autism, a condition characterized by profound impairments in social communication and behavior, would have stood out like a neon sign. There were 14 cases. That's 4.7 per 10,000. So we know what the historic numbers are. And we know what the numbers are today, and it's time for everybody to stop attributing this to this ideology of epidemic denial. In 2009, the California State Legislature charged the Mind Institute at UC Davis with because this myth was already becoming pervasive, the myth of epidemic denial was already becoming pervasive in the mainstream media. The California legislature directed the Mind Institute at UC Davis to answer the question. And Irva Hertz-Pichota was a highly esteemed, revered scientist, neurology, and epidemiologist, came back with a definitive answer: the epidemic is real. Only a very, very small portion of it can be changed to can be charged to better recognition or better diagnostic criteria. I want to say a couple of other things. There are many, many other studies that affirm this, and instead of listening to this canard of epidemic denial, all you have to do is start reading a little science, because the answer is very clear. And this is catastrophic for our country. There's a recent study by Blaxell et al. And a team of other researchers that said that the cost of treating autism in this country by 2035, so within 10 years, will be $1 trillion a year. This is added to already astronomical healthcare costs. And then there's an individual injury. These are kids this is a preventable disease. We know it's an environmental exposure. It has to be. Genes do not cause epidemics. They can provide a vulnerability. You need an environmental toxin. And Irva Hertz-Pichota pointed out that because of this mythology, that the amount of money and resources put into studying genetic causes, which is a dead end, has been historically 10 to 20 times the amount spent by NIH and other agencies to study environmental factors, to study exposures, to study external factors, and that's where we're going to find the answer. This is an individual tragedy as well. Autism destroys families. More importantly, it destroys our greatest resource, which are our children. These are children who should not be suffering like this. These are kids who, many of them were fully functional and regressed because of some environmental exposure into autism when they're 2 years old. And these are kids who will never pay taxes. They'll never hold a job. They'll never play baseball. They'll never write a poem. They'll never go out on a date. Many of them will never use a toilet unassisted. And we have to recognize we are doing this to our children, and we need to put an end to it. And I think I'm going to have Walter Zaharodny, who is the most senior researcher for this project for ADDM, and who's been doing this for many years, to come up and...
You've been listening to a press conference in Washington, D.C. with the Health and Human Services Secretary Robert F. Kennedy Jr. there. He has been talking about a new CDC report that is tracking a rise in autism cases in U.S. children.